We Americans like to say we're pragmatists. We stick with the things that work. And that may be true in many parts of our life, but as far as I'm concerned, it's not true right now in our healthcare system. The approach to mental illness as well as physical illness tends to be the following. We wait for people to break down and we park ambulances at the bottom of the cliff. And we have to question that in this day and age. Where does that come from? Well, I believe it comes from two mistaken assumptions. One is, if it's not broken, there's no need to fix it. And that's the idea, we don't need to prevent it, but the second one is where that comes from. If it does break down, we'll find a cure. We'll fix it. I believe this. And I should tell you, in the interest of not being politically indelicate or inappropriate, I suffer from mental illness. I have PTSD. I have bouts of depression. And so I know the system pretty intimately. So it goes something like this. 1996 was a very important year for people like me. It was our Declaration of Independence. A study was published called the Global Burden of Disease Study. That study was the first to put mental illness on the top 10 list of conditions that are causing significant economic and social problems to all nations on this planet. It was the first. Every study done before 1996 focused only on death. And the top 10 list were the health conditions that cut our lives short the most. The big change was the following. It may not sound like a big change to you, but it is to folks like us. In addition to including the number of years shortened by health conditions, the Global Burden of Disease study included the amount of disability that was created by those conditions. So if it didn't cut your life short, how much did it prevent you from living a full life? Depression was in the top 5 list, along with cancer and heart disease. I can't begin to tell you how much this shocked governments around the world, and it's still shocking them. So that put mental illness in the top 5 list, and here's what it meant to folks like us. For the first time ever, it meant that our governments need to put money towards it through their public health systems to really take it seriously. And if we don't, the WHO, the World Health Organization, predicts by the year 2030, depression will be second only to heart disease in causing significant problems to many countries on this planet. Not just developed nations, developing nations, the places where we think it's all infectious disease. No, depression. 2006 was another important year for me. I opened up a journal called Molecular Psychiatry, and a person I know dearly and respect very, very much, who runs the National Institute of Mental Health, wrote an article, and part of the title said, Cure Therapeutics. It was the first time I'd ever heard anyone who directs the National Institute of Health say the following, and especially for mental illness. All known treatments, talk and medication for mental illness are palliative. None are even proposed as cures. That is to say, all they do is treat our symptoms. Now that isn't to say they're not effective in getting us back in the game. They work. They alleviate symptoms, like wanting to end your life, wanting to sleep the entire day, eating too little, eating too much. And the problem was this. They argued that up to 2006, all research in mental illness sought only to improve on existing therapies. I won't go into this, but almost all the medical miracles that we can think of that today when it comes to medications for mental illness were accidents. Somebody trying a drug that was built for something else and say, hey, let's try this on somebody who's sad. What does it do? And if it uplifts their mood, guess what? They spend the next several decades improving upon that drug. Well, he said, stop that. You know what we need to do? Shoot for a cure. That sounds like a great thing, doesn't it? It's pretty hard to argue with that. It made me livid. I thought it was promising way too much. There are over 350 mental disorders in the Diagnostic and Statistical Manual. There's no one cure for any one mental illness. And even if they find a cure, my research suggests they may not even promote your mental health. They may alleviate mental illness symptoms, but they may only leave you empty. So what was he doing? His job is to bring more money, taxpayers' money, into his institute to do the same thing again and again. Study mental illness, look inside the hood, the brain and our genes, to find a cure. That's where that comes from. You know Benjamin Franklin's definition. What we're doing now for mental illness is what we're doing for many illnesses in our country. Let's do more of the same thing over and over, and now let's expect a different result. Well, I'm tired of that. We live in a country that encourages us to give away our health, whether it's intentional or not, because they promise us one medical cure after another. Now here's the problem. If you give away your health, our healthcare system is going to require that you buy it back. And not many people can afford that, and certainly not a nation that's going to be competitive in this century can be spending as much as we do on parking ambulances at the bottom of the cliff. I'm tired of it. And I think there's an alternative. Let's take health seriously. Where does mental health come from? I study happiness. I know TED Talks there's a lot of happiness talks on TED. This might be the most depressing happiness talk. But bear with me, there's hope. I want to talk about the signs and symptoms of good mental health. One group comes from psychological well-being. Psychological well-being is about accepting who you are, liking most parts of your personality, having warm, trusting relationships with other human beings, being challenged to become a better human being, growing, having purpose in life, have a direction and meaning to your life, being able to manage your daily responsibilities, and autonomy, confident to think and express your own ideas and opinions. Anyone here against any of those things? I hope not. It's not just psychological. We don't get to live our lives entirely in the pronoun I and me. We also live as we and us. And there's a thing called social well-being and functioning well. It consists of things like, do you accept and trust other human beings? Do you belong to a community where you derive a sense of comfort and joy? Are you contributing anything of value to the world around you? Can you make sense of what's going on in the world around you and why things are happening the way they are? And are you being challenged to become a better kind of people, a better unit, a better workplace, a better city, dare I say, a better kind of American? Are we being challenged to become a better kind of people? Last but certainly not least, there's a tradition of happiness that goes back to emotional well-being. Do you feel happy? Do you feel satisfied? And are you interested in life? Where do these come from? Well, the first tradition is about functioning well, and it goes all the way back to a fellow named Aristotle who championed a kind of happiness in doing well in life, or doing life well, as an individual and as a citizen. The other tradition goes back to Epicurus. It's about feeling good. He championed a form of happiness called hedonism. It didn't have excess. It wasn't, the excessive connotation back then wasn't the way what he was talking about. He was talking about simple pleasures. Now here's how I put happiness together. I call mental health flourishing because you can't use the word mental health. It's been taken over and obscured and confused. Some people think, well, we're talking about mental illness. And other people say we're talking about the absence of mental illness. No, I'm talking about the presence of those signs and symptoms of happiness. What does it mean to flourish? Every day or almost every day in the last month, you felt one of those three emotional well-being combined with 6 or more of the positive functioning. Now, if anyone here knows how to diagnose depression, you will see a resemblance here. To diagnose depression, you have to have one of two symptoms of anhedonia combined with 5 or more signs and symptoms of malfunctioning. I built the diagnosis of positive mental health on the platform that psychiatrists built for the most canonical mental disorder, depression. Turned it on its head, parked in their garage and said, you're not going to get rid of me until you start taking mental health serious. Languishing, well, that's emptiness. We'll get to that, but I want to move on to talk about something very important. These are twins, and they helped me investigate a very important hypothesis, something that was near and dear to me. It's been around since 1941 in a book called Medicine and Human Welfare. On page 100, Henry Sigaris says the following: health is more than the absence of illness. It is something positive. Now, if your child brought that home in an essay and they said, what is kindness? And that was their essay, the task, would you give them an A for saying it's something positive? No. We've put up with that for decades. Why? Because we think illness is more serious than health. Well, that hypothesis is testable. And here's what we found. Flourishing is just as heritable as things like depression. And it only partially overlaps with the genes that we inherit for things like depression and panic disorder. Over half of the genes that we inherit that give us potential for flourishing operate independent of the risks we inherit for things like depression. We're born of two potentials. It's in our DNA. And what it means is the following. Just because you inherit a risk for depression does not mean you will not flourish, because you could also inherit a very high genetic potential for flourishing. And conversely, just because you don't have any genetic risk for depression doesn't mean you're out of the woods. You may not have inherited a very high genetic potential for flourishing. The absence of illness does not mean the presence is health. It's not just in the way we think and answer questionnaires. It's in our DNA. So what does that mean? Well, this is what it looks like, this two-continuum model. I put up flourishing because that's where we say we want to be in every public health document. I want to be in a healthier country. That's where we do want to be, people. And here's why. 1, the absence does not mean the presence of mental illness. This is the typical way we look at the world in black and white. This is a study of US adolescents aged 12 and 18. We could diagnose whether they fit the criteria for depression, 14% did. We would assume in the usual world that 86% are mentally healthy, right? Wrong. Less than 4 in 10 of our teenagers are flourishing and free of something as common as depression. We're not anywhere close to having an adolescent population that's starting out with a tank full of wonder and joy. Second, anything less than flourishing creates problems for society. It's not just depression and mental illness, people. So here's a study of college students, a huge study that we've been doing, and here's what we're finding. Risk for suicidal attempts and plans increase as level of good mental health decreased. Now, these are college students who would screen free of mental disorders in the past 2 weeks. Things like depression. Are they out of the woods? No. Most college students are free of mental illness, 75%. Are they out of the woods? No. And if they have mental illness, does level of mental health matter? Does it ever? Yes, 6% of US college students are flourishing with a mental disorder, and they have easily half the rate of suicide as those with moderate mental health, but also mental disorder. And look at if kids are languishing, no well-being, and mentally ill. So, here's what this looks like. We tend now to say that mental illness, depression is a serious problem, right? It is. But so is anything less than flourishing. Just because you're free of mental disorder does not mean you're not missing days of work. You're not showing up to the doctor asking, what's wrong? Healthcare utilization goes up for those who are not flourishing. Missed days of work go up for those who are not flourishing. And it gets worse. The absence of mental illness is often as bad as the presence of mental illness. A study looked at these 6 activities, whether you were performing more of these, and the hypothesis was if you did more of these in a typical day, you would end the day feeling happier and more satisfied with your life. That's true for 5 out of 6. Exercise didn't do it. Sorry to say that for the prior speaker. But here's what happens. Look at, everyone starts with very low enjoyment of life if they do nothing. Here's what happens if you're depressed. If you do more, at the end of the day, you end up with more good feelings and enjoyment. But look at not flourishing. It's almost indistinguishable from those who are depressed. Now, these are people not flourishing, are not depressed. But look what happens if you're flourishing. The absence of mental health is often as bad as the presence of mental illness. Most of the American adult population is not flourishing. We have a lot of big problems on our agenda. It's not just mental illness. So here's where I want to end. The medical system will say, Corey, well, we can measure all kinds of mental illnesses, physical and mental. It's really specific. That stuff you're talking about, it's something positive. Well, guess what? We can measure mental health the same way we measure mental illness. Then they will come back and say, well, Corey, isn't health and illness belong to a single continuum? I say, no. Even if you could cure mental illness tomorrow, doesn't mean we are anywhere closer to flourishing. Well, then they will say, oh, Corey, here, bless your heart. Mental illness is a burden. And I will say, yes, guess what? But so is the absence of good mental health. And then they're going to get harumphed and say, well, wait a minute. There's too much mental illness in this world. And I'll say, you're right. There's also not enough flourishing. They're both problems. And last but certainly not least, they will say, wait a minute, I'll give you money to do this. Now, I'm not pitching from the stage. I'm simply saying, we'll support your research when we fix all the problems. And guess what? We have studies showing that it's the loss of good mental health that precipitates the falling off the cliff. So you tell me what's more serious, people. What are we waiting for? More of us to break? I'm not doing it anymore. Everything looks like a nail when all you hold is a hammer. All of us are patients in a country like this where the only tools for promoting health are hospitals, clinics, diagnostic tests, and doctors. I've grown tired of being considered a patient in waiting, another disease waiting to happen. I have dreams, I have hopes, I have a purpose. I want to live in a country that takes flourishing and health as serious, no, more serious than it does our floundering and our illness. Now think about that. Thank you.